Hello, I'm Sarah Webster, and I just wanted to give you a little bit of an insight into OLDPAIN2GO. If you need to, I've put a link on my site so you can go through to see Stephen Blake's official site, and there's lots of very detailed information. But suffice it to say, if you've got pain or allergies, if you've had those diagnosed by a doctor, and there's nothing that they can do for you, it's painkillers or just learning how to deal with it through whatever technique you can find. Well, if the answer to these questions is yes, then OLDPAIN2GO could be right for you. If you're suffering from ongoing conditions and they're drastically affecting your life, you can't do your hobbies, you can't go to work possibly, or work is difficult, maybe even affecting your relationships. Well, there are things you can do, and painkillers have a lot of side effects, and nobody really wants to be taking them all the time. So what I'm saying is I'm giving you an option that could quite possibly delete all that pain. Now, how does that work? Well, as we know, the brain is where the pain is. Because even if you've had your leg chopped off, people can feel pain in a big toe or a knee, and it's not even there. So it's in here. And the other thing we all know is if you've got a sore finger or sore knee and then you get toothache, oh boy, do you know about the other hurt? No, the only thing that hurts is your tooth. So it's in your head. And it's there because it has to, new pain, acute pain, is there telling you to get something done. Go see the doctor. You've broken this, be careful. Dentist, it's a alarm system that's helping you to know that something needs to be done. Chronic pain, of course, is something quite different. And the damage has been done, and you've just got this pain that is not serving you, just making you uncomfortable and debilitated. Well, with OLDPAIN2GO, we look through the unconscious mind to see why it's happening, what benefits. It may be that your unconscious mind has found it a way to stop you doing something that is not beneficial to your condition. Say, you've got backache every time you ride a horse. Well, maybe it's time you didn't ride a horse, or looked at how your saddle and things, make it different. So if we bargain with your unconscious mind, you can not go horse riding or look at doing it differently or strengthening, so that your unconscious mind understands that it's not necessary to have that pain anymore. And while you abide by your agreement, there will be no pain. So maybe take up cycling instead of horse riding, or just walking with horses. It's doing something different. And I always get carried off on a tangent. I'm trying to cover everything here. And it can be done very, very quickly. It's not hypnosis. Not that there's anything wrong with hypnosis, because I am a hypnotist as well. And I can use those methods too. It can help with things like arthritis, back pain, sciatica, migraines, IBS, and many more conditions, including, which Stephen Blake is really known for, his technique is known for, is fibromyalgia and chronic fatigue syndrome. Extremely effective, because if you have those pains going on your body has found a way of stopping you doing excess, and while it's working, it's going to stay there. And as we know, fibromyalgia comes after some sort of trauma or some difficult time in your life, and there's all sorts of associations going on with it. So this can be extremely effective, providing you abide by your decision. So release the pain, but I won't work myself to the bone. I'll work up to it. So yes, it can be extremely good, and also very good for psoriasis, hay fever, possibly. So anything that can give you relief, come along, try it. It's wonderful. Give me a ring if you're interested, or like I say, you can go to Stephen's website, which I've OLDPAIN2GO. I'm happy to talk to you if you've got some condition that you think is in that category of old pain, so your only option is painkillers. So contact me. I've got all my details on the website. I look forward to hearing from you. Thank you. Bye-bye.